Okay, so it is indeed in progress. Okay, so good afternoon. It is 2 minutes past 3 on a Monday. So you've got the rest of the week ahead of you. Excitement, hey. I'm Neil Greenberg. I am delighted to be here to chair this session, which will go on till 4 o'clock. Before I introduce Joe, who will be the main act of the day, I just thought I'd give a little bit of background. I'm a psychiatrist myself, ex-military, and I'm also delighted to be the president-elect of the society, which is very good news. Well, good news for me. Hopefully, good news for the society. We'll find out from next June. Mental health at work and mental health and well-being, obviously a really topical subject. It's very hard to go a whole week without newspapers mentioning something about, my mental health was affected at work and this, that, and the other. And if you look to sort of more robust surveys than the ones you get in newspapers, the adult psychiatric morbidity study, which was last officially reported in 2014, it's a really good study done using interviews rather than questionnaires. And that basically showed that around 1 in 6 people in the UK have a mental health problem that would be sort of diagnosable, which is 17% quite a lot of people out there. And we know there's an interplay between people's work and their ability to have good health, and people's health and their ability to work. And clearly, the government's current agenda to increase the productivity and make the UK a more successful place, I'm sure everyone on this call will know that that is only going to happen if our workforce can enjoy a good state of mental health, because if you're not in a good state of mind, you're not going to be productive. And of course, that's even more important in safety critical organizations, our pilots, our train drivers, our coach drivers, and healthcare workers as well. So that basically meant that probably about a year ago now, one of our Society of Occupational Medicine board meetings, we discussed the topic of well-being. It's not surprising that many organizations are interested in improving the well-being of their staff. And of course, well-being is on a spectrum leading into sort of mental health disorders. But our view was it's a bit of a wild west out there, in the sense that if you're someone who's helping an organization to choose well-being initiatives, you might be from HR, you might be from occupational health, you might just be a well-meaning manager. It's quite hard to know which intervention to go for. And certainly I remember going some years ago to a very good presentation about snake oil salesmen. And nothing against snake oil, other than it didn't do the job. It wasn't very helpful. But it'd be very hard to know whether someone's being very charismatic or whether someone's actually going to give you an intervention that's going to work. And so basically what we decided is that our first stage of trying to do something about this from an occupational health leadership point of view was to get this wellbeing guide established, so that we could help people who make decisions about commissioning wellbeing initiatives to do so with the right information, having asked the right questions, and importantly, as Joe will talk about, making sure that it fits into what the organization does as a whole. And so Joe and her team very kindly agreed to take on the task of pulling together this guide, and she's going to talk to you about what it is and what's in it, and very shortly. For those of you who don't know, and I suspect most of you do, Professor Jo Yarker is a registered and chartered occupational psychologist. She's a professor of occupational psychology at Birkbeck, and also a managing director, or managing partner, I should say, of Affinity Healthcare as well. So, Joe, I'm going to turn the floor over to you. I'll let you speak for as long as you need to, as long as it's leaving a bit of time for questions. And then for those of you who are listening, please do write down or think about questions. And at the end, I will happily take them. I'll ask you to turn on your microphone and your camera then. But in the meantime, sit back and enjoy what Joe's going to say. Thank you.
Great. Thank you, Neil. And it's wonderful to be here. And you've covered a lot of the scene setting, which is fantastic. So in terms of why we've been involved and where this comes from, I'm Jo Yarker. I have a business where we're working with organizations to implement and test and put in place different aspects of wellbeing. services. And then in my other half of my life, I'm an academic and looking at what works and evaluating what works, doing research in terms of creating new products and services and also then testing them. And so it was a real privilege to come and support Som in developing this guide, because I think, as Neil was saying, there are so many different things that are out there. We recognize that it's really key to invest in these services. There's been such a growth in the market, and it's really difficult to know what works and what doesn't, what's going to be right for your business. And what we've really seen is this proliferation of different types of roles, but people coming to wellbeing with incredibly good intentions, wanting to make the difference, but perhaps having a missing piece of the jigsaw in terms of their professional development and their knowledge and skills in really assessing what works. And I think that all together makes it incredibly difficult for people to know what to do. There's been a huge amount of work that Som's been doing in terms of trying to raise the profile for occupational health and wellbeing services in organisations. And if you haven't done already, this is a great report by Kevin Teo and others that has been really looking at the value of occupational health, but also what do we do when we're working together with HR, and how can that really in a synergistic way help to make better changes in organisations such that people are really well supported through challenge, but also to sustain work in the long run. And Neil hinted towards this, the challenge that we have ahead, and I've placed this here because I know that for so many of us thinking about the business case in our organisations and why we really need to focus on it, is thinking, how do we really help those people that are of working age stay in work, or if they're returning to work, how do we help them return to work? And health and wellbeing services are absolutely vital for doing that. So we have a huge challenge ahead. And the key questions that we're really aiming to answer in this guide are we investing our time and resources in the right things? And also, are our organisations, our teams, the individuals that are accessing these services, are they set up for success to really make the most of the things that are on offer? So what did we do? We took an evidence-based approach to developing the guide. So one of the things that we do across all of our projects is really look at what's out there already. So we did a rapid review of what is good practice, both from an academic perspective and a practitioner perspective. We were also really fortunate to speak to a number of OH leads and wellbeing leads about how they make decisions and what questions they have when they are looking at services and what they're trying to understand when they're differentiating between these different products and services. We also then pulled all of that together and started to develop the guidance. And we've been really fortunate to develop guidance for CIPD in collaboration with Sheffield University and Loughborough University. And we've also done a lot of work looking at, well, what is good digital wellbeing? And a project with the NHSA really helped us understand that. So we put all of that together, presented the guide templates and so on to the Som Council, had some really great feedback and integrated that into the final guide. So hopefully the information that's going to be shared is something that is useful regardless of your role. So when we were talking to people, we found that people had different decisions to make, but actually they're faced with very similar challenges. So you could be a CMO working in a large manufacturing company, wanting to roll out a program for MSK. But actually, how do you need a program that will deliver an increased movement, but how do you make that choice? Or you could be a wellbeing lead in a professional services company and wanting to really develop your whole strategy and wanting to understand what could be in that strategy. But there's so many offers out there. How do you know what's right, what's not, what's going to be a best fit for your organization? And also in SMEs, often what we find with our work with SMEs is somebody will be tasked with wellbeing, but not really know where to look and understand what might be a good product or service. And so if you need to upskill your managers, what are you looking at? There's so many different training providers out there. So we wanted to think about some of the evidence-based models that will help people make decisions, and that's really our starting point. So when we're looking at these, we found 3 common questions. So one, what is it that you want to achieve? Are you really clear on what it is you want to achieve? Are you really clear on what success looks like for you? And are you aware of what those trade-offs might be? So with my academic hat on, I know what good evidence looks like, and I might want to look at something that has lots of randomized controls behind it. But actually, sometimes there are new products or new ideas out there that maybe don't have that evidence base yet. And what's the trade-off between going for something that is new and innovative, but perhaps doesn't have the evidence, versus something that is very well and tested, but perhaps doesn't have the bespoke nature that will fit with your organization. So getting started, we want to think of these three things and spend some time really being clear on what it means for your organization. And to do that, we can use some frameworks around what good looks like. So when we're looking at a good wellbeing program overall, one of the things that people say as their starting point really is to define what wellbeing means for them. We also need to be clear on what those legal obligations are, and we need to take a systemic approach and a shared approach, as well as look at our evidence-based solutions and ensure that we're consulting with our employees regularly so that we know what they're interested in and what they need. So I'll go into these aspects in a little bit more detail. So the starting point is defining what wellbeing means for your organization. And I think this is often where people perhaps have thought about, but don't necessarily spend time when they're first starting to think about their wellbeing provision. And here are a few different models, one from What Works Wellbeing, but others that you'll see. And essentially, what are the key drivers that you're going, or the key pillars of wellbeing that you want to ensure are underlying your approach? And every organization will have a slightly different setup, but it's thinking about what your workforce, your resources, better to do a few things well than overcommit yourself and have too many areas that you're going to target on first of all. So what are the key areas that you're looking to really foster well-being? Because that's going to be really important when you're thinking about your evaluation later on, because they're the things that you will want to measure against and see improvements against. The other thing that we can think about is our legal obligations. And this is something I think when we're talking to employers about well-being broadly, often the things that are put in place are sometimes nice to have when the legal obligations aren't necessarily something that they're aware of. So UK employers have a duty of care to protect the physical and the psychological health of their employees. And so this includes protecting worker health through conducting risk assessments. And I think we're very, very aware of what those physical risk assessments are, and fewer organisations are aware of what and how to do psychosocial risk assessments. So the hazards that are around relating to the psychological or the social aspects of work. And that's something that we really need to think of as employers when we're thinking about our broad strategy and our broad provision. Are we thinking about what those risks are and making sure that we mitigate them? As employers, there's also that statutory health surveillance for specific hazards, and then ensuring that employees are supported if they have health conditions or disabilities so that they can stay in and retain and stay well at work. So every organisation will have a different need to focus on specific risks. But if you're an organisation where you have lots of lone working, for example, that might be something that you focus energies on specifically. So it's really important to think of your obligations with regard to the context of your work. We then want to make sure that when we've got different things in place, we think about a layered systemic approach. So we want to, at the first instance, ensure that we've got things in place to prevent harm. So thinking about good work, as well as extra wellbeing provisions. So wellbeing comes from all these things together. So providing good work conditions where people have well-designed and managed jobs. We also want to make sure that we're providing them with support and development such that they can access opportunities to modify their work and respond to some of the challenges that they might have. And so with this support and development, it might be that that's work-specific training, making sure that they've got the skills that they need to do the job that they're being asked to do. Or it might be developing skills in psychological techniques and practices such that they can cope with some of those demands in the job. Say, for example, if it's really emotional content, or if it's a particularly demanding role, have they been developed in those psychological techniques to manage it? And then at the third level, we want to make sure we've got things in place that can help people restore and repair. So when they have been under struggle, have they got timely access to that support? So an EAP, signposting, occupational health provision, and so on. So looking at our whole wellbeing offer, we want to think about, is it systemic in its offering? Do we actually look and think about these three different levels of provision? And what we find through our practice is actually a lot of the provision is at that restoring and repairing level. And so it's thinking about how do we really try and build in activities that also prevent and also support and develop. And one of the key reasons, apart from that being good practice and ensuring that the individual isn't put in harm's way, is from a business perspective, the Deloitte analysis would show that your prevention is your best return in any event. So focusing activities across that system is really key. Another thing that we have been doing a lot around is trying to think about how we can promote a shared to health and wellbeing. And with this, we've been doing a lot of research with Karina Nielsen and other colleagues up in Loughborough and other universities to think, well, what are those key ingredients that support people to stay and work over the long term? And within the return to work research that we've done, we found that a lot of the time we're operating in silos. So we might support the individual and help them with their resources and the things that they might need to get back into work. And then we'll train the line managers so that they are better equipped. But actually, we often forget to look at the whole system in one go. And so the IGLU framework helps us really think about what's in place at each of those different levels and then better articulate the roles and responsibilities of people at those different levels. So within our IGLU, we want to build this protective shield so that we all have the resources that we need to do our job. And within that, we have individual resources, so things, actions that we can take ourselves, but also we want to be able to draw from our colleagues, and there are specific things that our co-workers might be able to do in terms of the support and feedback that they give, stepping in to support us when we're solving problems and so on. There are things that our line manager can do around supporting us with risk, but also access to work adjustments in terms of their own behaviour and the way that they present and consistently present in the workplace, such that they can help us manage our own work. And then at the organisational level, we need to have the right policies and practices, the right training programmes in place to ensure that everybody in the organisation is supported. But equally, we know that there are lots of outside demands and outside resources. And so not everybody is going to want to come through their organisation to get the support they need. So as an organisation, it can be really helpful to signpost some of the external aspects of support so that people can really ensure that they meet their needs at the time of need. So we have our levels of prevention in a systemic way, we have our IGLU, and then we have evidence-based solutions. And the evidence-based solutions are really helping us to think about what is the evidence for what I'm being offered or what I'm looking at from a product and service. And the Nesta standards of evidence, I find are really helpful to just prompt me to think, what is the evidence around here and what kind of quality is that evidence? So Nesta have looked at how research develops and how confident we can be that something really is making a difference. And they have these different descriptions of levels of evidence at each stage. So at level 1, it's that you can describe that this intervention, this activity makes sense. You can understand that it would logically and clearly map to having the impact that you might like. And so the kind of evidence at that level is maybe a qualitative study where somebody's saying that they think it really, really helped. You know, I really liked this. It made a difference. I felt so much better after I'd been on this webinar course, or I've been feeling so much happier since I've been practicing gratitude. But at level 2, what you're doing is you're showing that there is a positive change, but you can't really be sure that that's what happened. So that's perhaps where more people that have done the gratitude training have also reported higher well-being, or those that did the movement course and were given all the exercise bands to make sure that when they're in their driving job, they take breaks and they use their exercise routine. They also are feeling better. But at level 3, what you're doing is you're showing that that intervention, that activity made a difference over and above work as normal. And so you're able to show that actually there was a significant difference between some people that tried it and those that didn't. At level 4, you've got findings that are replicated in different work groups or different areas, and you're building that evidence. And then at level 5, you have a huge amount of evidence, and everything is very, very consistently showing that there is a direction of travel, showing that the intervention or that activity makes a difference. Now, in the wellbeing sphere, whilst we might have CBT, for example, and there's good evidence and protocols for CBT activities, actually for most workplace wellbeing interventions, we're really down at level 1 and 2 evidence. So it can be quite hard to really make sure that you're making the right decision. But asking your providers, having conversations about what they're doing, what they're showing, and also investing in your own research can really be helpful to pull our workplace wellbeing evidence up towards level 4 and 5. So we can use these questions to review, and these frameworks to review where you are now, and also identify where there are potential gaps or any emerging new workforce needs, such that if you think about your provision through each of those lenses, you'll be able to unpick really where those key next steps need to be. And so we've got our strategy, and then we want to think about the product itself. So when we're looking at each of those products or each of those services that are offered, what are we really wanting to look for in them? Because that in itself can be quite difficult. We can use those frameworks to help us understand a little bit, but in each project, when we're evaluating it as it's fit for our business, we want to think about the end-to-end considerations. And one of the things that's really, I suppose, a byproduct of having to do lots of research applications is you have to think about how are products or how are interventions designed, and what is the best practice in terms of designing something, ensuring that it's theory-led, ensuring that it's accessible to everybody. And then how is it delivered? How's it implemented and how's it evaluated? So we need to think about the end-to-end of the journey of that activity that you're engaging in, because often what we see through research is something may have been designed really well, but it's then not implemented, and therefore it doesn't have the effect that we want it to have. Or in fact, it might not be very well designed, but it's really well implemented, and therefore there is a slight movement in the direction of travel. So thinking about all of these different ingredients can be a good starting point to evaluate the different products and services that you're considering. So when we're looking at design, we want to be thinking about how somebody came up with the idea. If you're looking at mental health training, what is it that they did to design the program? Did they speak to people who have been experiencing mental health challenges? Did they speak to senior leaders about what they were seeing in their workforce around some of the challenges? So was it co-designed? Were lots of the key stakeholders involved in that design? You also want to know whether it's theory-led and evidence-informed. So what are they looking at when they're developing their materials, or they're developing their strategy to intervene with your workforce? What is it that they're actually drawing on? Have they got a foundation? Because actually what we know is in practice, things that are theoretically led or evidence-informed are going to be much more likely to be successful. One thing that we see is a real requirement, particularly for health interventions and also digital interventions, is this idea of universal design and accessibility. And I think we're all becoming much more aware of the need to ensure that all of our workforce can access the things that are being made available to them. But often what we see when we're reviewing some of these materials is that they can be designed for graduate level as opposed to all staff. And so thinking about the access and the visibility of those materials, but also the reading age and the extent to which they're framed to be appropriate to different groups within our workforce is really key. So looking at the product and service on offer through the lens of universal design, through accessibility, is a really vital part of that interrogation. And you could bring your employee resource groups in at that stage to also have a discussion and explore how that's being received. Sorry. And then what's the evidence for that design? Have they tested and piloted it to start with? We've then got your delivery, and there's a load of research that has come out in terms of looking at the implementation factors that can be quite important to think about in terms of careful consideration about where you're delivering it, when you're delivering it. So often what we see is people have access to apps as part of their wellbeing program, or access to training that's online so that they can fit it around work. But actually, it's really hard to ask people to do things that are good for their well-being over and above their work, because they're likely to go home to busy lives and lots of demands. So if we want to provide something in a workplace wellbeing program, providing protective time can be really helpful. Thinking about different formats so that they are really accessible to those people that need to reach them is key. And I think one of the things that we've seen in the research is often that people that really need those interventions are the least able to access them because they're on an app, or because they don't have anything that's digital, for example, with them during the working day, or they're in a busy high volume. And then what's the ethical governance around that delivery? So who's delivering it? What qualifications do they need to have to ensure that that delivery is done in a consistent way, but in an ethical way, such that if there are any concerns for mental health, for other wellbeing health issues, that they have an appropriate response in place to ensure that that person gets the support that they need. When we're looking at implementation, we want to be thinking about how can we really make the most of what's hopefully a very well designed and set up product. And so here we absolutely need senior sponsorship. There's a growing amount of evidence that shows that where senior sponsorship isn't in place, it doesn't get the traction that it needs. Communicating regularly in different forums, in different ways, to reach as many people as possible. But also protected resources. So where interventions often fall down, it's where there has been a lack of coordination or a lack of resource internally to ensure that that rollout of implementation is taken forward. And then ongoing post-delivery support. So it's all very well delivering something, but what comes next? How are you following up? How is that training transfer, or that transfer to the work environment and the sustainability put in place? And then how do we evaluate? I'm not sure if you've come across the re-aim framework, but that's quite a neat little framework that helps us think about the different things that we might want to look at when we're evaluating. So are we reaching people? Who are we reaching? What are our numbers? And who are those people? So are we getting a reach in the first place? But also, is it effective? Is it making the change that we want it to have? Are people actually adopting it into day-to-day life? And is it being implemented in a consistent way, in the way that we had intended? And are people able to maintain and use the activities or the learnings or the skills and keep up the habits that we're training in the first place? And so when we're looking at these different aspects of evaluation, it can be really helpful to think about our starting point. So what was it that we wanted to change? What was our key purpose for putting something in place? And so we can use the re-aim framework to really understand whether we're reaching the people we need to be reaching and we had hoped we would reach, rather than, as the Oxford and Rand study showed, often people that engage in these services are people that might be accessing them outside of work anyway. So are we reaching the right people? And did it impact on the thing that we really wanted to change in the first place? Is it having that direct and targeted impact? So here we could be looking at the reaction. So do people enjoy it? Are they finding it useful, engaging? But also, are they learning new knowledge, skills, and so on? Are they changing their behavior as a result? And also, is it then impacting outcomes of interest over time, whether that's job satisfaction, whether that's general well-being? What is it that you wanted to impact over time? And then are people being able to use those skills and knowledge in practice? And has it been delivered consistently across different work teams in different areas? And then last of all, have we ensured that we've got the capacity and the systems in place to ensure that it's incorporated over the long term? So a number of frameworks that we can use to think about what we need. And when we are thinking about potential suppliers, we can think about how they are how they are putting those things in place. But we can also think about what potential suppliers need to know about you and your business. And this is something that was really fantastic when we were talking to different leads, talking to different suppliers, thinking about how that relationship can be most effective is really interesting because everybody has slightly different ideas. So what we've done is we've pooled all these different ideas and put them together. But essentially, one of the key things that came through around what suppliers need to know about you is that they really need to understand the business. So Magdalena kindly gave us lots of tips about how wellbeing practices and services are chosen at TFL. And she said a lot of companies will say that they'll personalize or target the product to your audience, but then when you go on calls with them, they don't ask any questions. I think understanding how we work is extremely important and should be extremely important to the supplier. And I think that's something that's really key, is the supplier listening to how you work, how your programs are governed, how they're interlinked between HR and health and safety and occupational health, how senior leaders have taken on or not taken on initiatives in the past. All of those sorts of things are really helpful to the supplier to really understand your business, but also it shows that they're interested in ensuring that something is going to work and really integrate into your organization. And what do you need to know about the suppliers themselves? And here again, we themed a whole range of different pieces of advice, looking at what was out there in the research, but also from our interviews. And it was very clear that there's no one right answer, but certainly that listening came out as key. So did they listen to and understand your needs? And in fact, sometimes it's okay for us, it's a good thing that they say maybe that's not the right solution. They don't have the right solution for your needs. And then you'll be more likely to go back to them for that particular solution in the future. But also, how does their solution fit within the wider wellbeing provision within your organization? So thinking about that systemic approach, thinking about the shared approach with the Igloo, where does it fit? Are they very clear about how it's going to fit into an integrated approach? Are they able to describe the stages of design? And are they talking about some of the things that are really key? I think this is where it's really helpful to have a conversation with the provider about their steps to design and understand what models and frameworks they're using, because often that will differentiate somebody who's got a great idea and really means well, but perhaps hasn't looked at the evidence to really design the program of activity versus somebody who has. And then how is it delivered? How have they delivered it in different organizations? What are some of the key considerations? Are they really thinking about that delivery in regard to your workforce needs and the type of work, the location, the demographics that you're aiming to support? And then what's included in the price and how is this reviewed? So often you can have really robust, really, really great products, but actually the pricing structure doesn't necessarily allow you to grow or scale or change and bespoke the product over time. So thinking about how that pricing is set up, but also what's included in it over time. Is there evaluation? Is there support? Is there an ongoing process whereby you're able to keep in contact with the provider to get data that you need? And then how do you scale? There are lots of recommendations around starting small and then building up incrementally so that when you are buying something new for your workforce, you start small, get those learnings in, and also those early adopters are going to be really helpful in terms of sharing those messages and extending your reach. So getting understanding of how that product or service can be scaled and what it really looks like in your organization. And then what support are you offered on an ongoing basis? So what happens if there is an employee in need? What happens if there needs to be extra training? What happens if somebody wants to come back with questions? What does that look like and what are the costs and timeframes included in that? And what reporting and evaluation is included, and who gets that data, how regularly? That's one thing that often we hear a lot of the time, is that people really struggle to get the data on the product services, whether that's a mobile app or an EAP service. Having that clear and consistent reporting can inform you as a buyer or purchaser of wellbeing services what's working, where your new needs might be emerging, and so on. So ensuring that there's a clear line of expectation and communication there can be key. And so in the guidance, what we also have is some case studies to bring that to life, where we've been really fortunate to have some of the best practice shared by our colleagues working in occupational health and independent practitioners. We also have some checklists, so taking those different frameworks into really accessible checklists and questions for you to think as you're going into discussions, okay, these are the things that I might want to be looking out for. I think one of the things that's very important to say up front is that very few providers have everything in terms of all of these gold standard markers. But what we can see is that there's certainly a real willingness and an openness for people to improve that evidence base and to do the right thing. So having those questions are a great starting point for exploring what might and could happen next. So in terms of our information that's available, we've got the new guide is coming online, hopefully later today. And please do contact us if you've got any questions at all that come out of that. So Nick's email is on there from a SOM perspective, but also you can by all means contact me directly. So a whiz-bang tour of all of the different elements within the guide, but I hadn't been able to catch the chat, but I saw that there's quite a few questions that have come up. So time for a bit of a discussion. So thank you.
Thank you ever so much, Joe. It's a really lovely run through. And what has happened is we put the link to the guide, which is now out, into the chat, which is very, very good news. Okay, so whilst everyone's just pondering on their questions and getting ready to sort of put their hands up, I'll just ask you one to start off with. How would you suggest? I mean, the Nesta levels of evidence are really useful. Some people, you hope some of the occupational health staff will have a reasonable grasp of that. Some HR staff perhaps less so. How would you try and help them understand really what the difference is between the different levels? And also I think the other bit is about, if I've got this study which was carried out in firefighters, and it's a great study, and this organization employs people to drive trucks, how relevant is that firefighter study to the truck driver population?
Absolutely, that's a really, really good question. So I think from looking at the different levels, it comes to the start is really, is it nice? Does it feel nice? I like watching Netflix, but it's not necessarily good for my well-being. And so does somebody like the thing, or is it actually really improving health? Is it improving general well-being? Is it including their improving their movement and reducing musculoskeletal pain, for example? And so it's just, I think, useful to think in the back of our minds. We often like things, but they're not necessarily good for us. And they don't always make the difference that we would like them to make. And so as we're looking at gearing up the levels of evidence, absolutely, at that first level, we want people to describe and say what they're feeling, what they're thinking. But we also want to ensure that over time, we are seeing that that feeling translates to change, be it change of habits, be it change to behavior, and therefore overall, hopefully change to health and well-being. So I don't know if that answers the first bit. And then the second one, in terms of how generalizable are they? And this is it's a really tricky question, because different things will be more or less generalizable depending on the context, depending on what they are aiming to do. So absolutely, if a say, for example, I'm just thinking of a sit-stand intervention, for example, that gives you little tips on how to make your your office more agile and people moving a little bit more during the office. And what we've seen is that actually some of those interventions can be really, really transferable, but they don't necessarily always work as well unless the office environment is set up to really support it. And so it could be that it's transferable, but you also want to ask questions around what needs to be in place to make this work? Why might it be useful to my population? What was it about the firefighters that made you think that this was a really good, sticking with movement, why was this a really good movement intervention for them? What was their challenge? What were they trying to do? How was it set up and how was it structured so that it was a success? And why might that be different in my workplace? So some things will be generalizable, but it really comes down to what exactly was it that they were trying to achieve and what were the factors that made it a success. And if you can understand that, you can then see whether it's going to be generalizable to your workforce.
That's really helpful. And I think I'd add from my experience is sometimes you're really desperate for evidence which is very linked to what you do, but that evidence just isn't available. And so you're often left with trying to translate what is available into what you have. And that should, but it's better to have some evidence most of the time than having no evidence at all, for sure.
Absolutely. And I think it comes to a really interesting part about the provider as well. So we know, for example, that psychological flexibility ACT interventions are really helpful for many people. But the person that is training that in your organization, if they can't, they can't bring in examples that are going to be relevant in your work context, it's probably not going to have the reach and the effectiveness that you'd like it to have. So what does the evidence say, but also can that person providing the service adapt and flex to your context, I think is a good thing to explore.
Absolutely. So does anyone have any questions that you could put your hand up? I'm searching through, or you can put something into the chat if you want to. I'm not going to call your names. Pick anyone to do a question. That would be very wrong.
I think it could also be interesting to see if there's anything we've missed as well. So there's if anyone has any good ideas of what you would look for that perhaps we haven't covered.
Yeah, or any good examples of where things have worked for you or haven't, which and I guess whilst you're just thinking, one of the other things that we are going to take as a next step to look into, at least in SOM, is this idea, and it's a sticky issue, of kite marking or accreditation. Because what would be great is to get to some sort of standard so that if you were to buy in a service, obviously kite marking can't tell you that the service provider is right for you or that the intervention's right for you, but it could tell you that the person in our organization that's delivering that intervention understands organizations and understands evidence and is trying to sell you something that might be useful for you. So do you put your hands up if you want to, or come off mute and jump in? We'll give it a minute or so. Towards that kind of slightly disquiet feeling of just waiting for someone to say something.
Hello.
Hi.
It's Debbie Troughton here. Let me put my face on. I just wanted to say thank you, Joe. That was really informative. And I really appreciated the point you made about aiming well-being activities to graduate levels. And I work in the food industry. We have a lot of transient workers, a lot of non-English speakers, people who are weekly paid on pretty much minimum wage, just don't have the smartphone or access to technology to access all the well-being stuff that's online. So it's really nice to see that noted, and just sort of trying to think, well, how can we engage people more when English isn't their first language, possibly isn't even their second language. They don't have the technical ability to go onto all the fantastic stuff that is online. So I'm always struggling. How do we hit those people? How do we really engage with those people who come to work to earn their basic money and they haven't got time to play with the soft stuff, if you like.
Absolutely, and I'm sure there'll be others that have got great ideas in that context. One of the things that we've been working on with the Health and Safety Organisation was they're looking at how they can translate health and safety messages in my mind's gone blank, but one of the UAE organizations, and there they have construction workers that come with all different languages, and so they're trying to convey messages through pictures. And how do you start to think about using cartoons that are acceptable to everybody, don't need language, but encourage people to ensure that they're engaging in good, healthy habits? And so that's been a very big challenge, but thinking
Yeah, they've
about
got Napo, is it Napo, the little cartoon man the health and safety put out, who does the working at heights and falling over. I think he's really good. So it's something like that would be, yeah, really good if we could get YouTube sort of access or something, you know, that's got that easy to understand in any language.
Yeah, absolutely. And biting off one thing at a time. Sorry, Neil. I was going to say, often we try and do so many things that actually, particularly when we're thinking about doing something visually and needing it to be translated into person or on the actually starting small and focusing on one thing is probably the best way, rather than trying to do too much.
Absolutely. I was gonna completely back that up, and yeah, testing and adjusting, because you put anything new into an organization and it fits for a while, but then other things change and then you need to perhaps alter. But that's good. Druska, you've got a hand up.
Hi, Joe. I might be asking a bit of a controversial question here, but one of the key things, I mean, obviously, you know, kind of the benefits of well-being are well established. Well-being is inherently quite a subjective sort of state of feeling. And so often businesses are looking for return on investment and looking for kind of hard markers or objective assessments of well-being, because my well-being yesterday might be different between my well-being tomorrow. So do you have any advice on sort of pragmatic responses to that, in terms of a sort of balance between subjective and objective outcomes?
It is a reality, isn't it? That there wants to be the productivity gain and
ROI, I think is the term that's usually return on investment.
I think we've seen a little bit of a shift with many of the people that we're working with to a broader understanding that direct relationship is often very difficult and it's very messy, particularly when we look at understanding some of the process factors. So actually, are we looking at what and how people are using the things that are there? What are the barriers to understanding? And that rich data is often, once you start telling those stories and finding out those stories, is much more compelling to some of our clients as well. And so absolutely that change is there, but we would always have a discussion around the fact that it's very difficult to really distill things take an impact when you don't have an RCT and you're not necessarily having different sites looking at different interventions, but really ensuring that you're combining all those measures with the storytelling, the tracking over time, have what those process factors around implementation are as well. So no silver bullet.
No, I didn't expect one, because I think you took the Netflix story. There are a lot of well-being services out there promoting that kind of, as you described, the feel good sort of this thing, that often do not have a substantiated evidence base. And so the subjective response can be quite overwhelming, such that, you know, there's sort of an appetite for more. And my difficulty there is that there's a lot of enjoyment and subjective sort of benefit from it when there is actually no evidence base, but my position is very
So I think looking at that evaluation framework where you've got the reactions and then the learning and then the behavior and the outcomes, so the outcomes are incredibly difficult for us to track, but are we seeing changes in those behaviors, and does that follow logically that that's going to lead to better outcomes? And so I think it's always coming back to those four different levels, and have you got metrics to cross all of those four?
Perfect. Thank you so much. Thank you.
I'll just add to that. That was a great answer, Joe. I went to an online lecture that Chris Whitty was doing once, and he was talking about a governmental level for society and implementing, and he basically said that if you're thinking about doing something, then the things to think about, certainly from a political point of view, is how much does it cost, how difficult is it to do, and what sort of level of impact will it achieve. So if it might not achieve very much, but it doesn't cost much, it's not difficult, let's go for it. But actually, if this is a perfect, wonderful outcome, but it's going to cost a lot of money and it's very difficult, it does put people off. So I think those aren't bad things to think of as an organization as well.
Mm.
I've got a question here, Joe, which is about moving to new providers. And the question is, sometimes there's a dilemma between sticking with an embedded wellbeing provider, particularly if there's no real quality issues, and moving to a new provider and the disruption that causes. What would be your advice about when the right time is to consider changing and the trigger for taking the leap with a new provider?
That's a really big question, isn't it? And I do not pretend to have the right answer on that one. I think my suggestion would be to do a review first. So what is it that you're not getting that you would like? And with the provider that you have, what are some of the things that you're uncertain of? Using those frameworks and then going back to them and seeing if that's something that they can change as well. Because if you are generally okay with your old provider, but you're looking for something new, maybe they could do it. They just haven't thought about it, or they haven't provided it yet. And certainly I think as a small business with my affinity hat on, there's loads of things that we could do with some of our clients, but we just haven't prioritized that yet because it hasn't been a demand, or it hasn't been something that's on our radar because we're delivering to something we've been asked to do. So I'd really encourage looking at what the gap is and going back to the existing provider to see if they can make that change. If it's something that you're really clear that you're not happy and you want to pivot, I think I would do a lot of due diligence in terms of asking other clients that they're working with how that working relationship is going, what they're getting for all of those different elements in terms of the feedback, the reporting, the ongoing support, to really ensure that you've got a good product that you're jumping into, but also good integration into your system so that they can talk through, this is how they will manage that integration, these are the and support and roll out, and this is how they're going to support you afterwards.
Great. Thank you very much indeed for that. So we're coming towards the end now. Any final questions or thoughts? There's no more I can see in terms of hands and nothing else in the chat. So I think I will just take the opportunity to say, Joe, thank you both ever so much for doing the presentation, which clearly has gone down very well, but also for the work that you and your team have put into the guide. Certainly I can say from the SOM point of view, we're delighted that this is now out, and we really hope it makes an impact, and all credit to you for doing all that hard work. Thank you.
Great, thank you. Lovely to be here, and thank you for giving us the opportunity to put it together. It's been good.